Mental mechanisms. Sigmund Freud first described a number of ego defenses. His daughter Anna developed these ideas and elaborated on them, adding 10 of her own. Many psychoanalysts have also added other methods of reducing anxiety. A defense mechanism is an unconscious psychological strategy that is used to reduce anxiety arising from unacceptable stimuli. Defense mechanisms operate at an unconscious level and help relieve unpleasant feelings. All individuals make use of these mechanisms in their daily behavior. It is important to remember that ego defense mechanisms are natural and normal and can be both good and bad. While well-adjusted individuals use them sparingly and in socially desirable ways, maladjusted individuals use them frequently and inappropriately. We use defense mechanisms to protect ourselves from feelings of anxiety or guilt which arise because we feel threatened. These defense mechanisms are unconscious psychological responses that protect people from threats and things that they don't want to think about or deal with. Some of these defense mechanisms include denial. Denial is an absolute refusal to admit or recognize that something has occurred or is currently occurring. If a situation is just too much to handle, the person may respond by refusing to perceive it or by denying that it exists. Denial is one of the best known defense mechanisms used often to describe situations in which people seem unable to face reality or admit an clear truth. For example, an addict takes alcohol every day and he cannot think of a day without it. However, he says, "I am not an addict. If I decide, I can give up." Or, smokers may refuse to admit to themselves that smoking is bad for their health. Regression. Coping with present conflict or stress by returning to earlier, more secure stage of life. In times of stress, behavior becomes more childish. This is known as regression. Regression causes you to revert to an earlier level of development and earlier, less demanding behaviors as a way of protecting yourself from confronting the actual situation. Behaviors associated with regression can vary greatly depending upon which stage at which the person is fixated. It enables a person to psychologically go back in time to a period when the person felt safer. An individual fixated at the oral stage might begin eating or smoking excessively or might become very verbally aggressive. For example, cry or temper tantrums in adults upon hearing unpleasant news or to overcome stress. Projection. Unconscious attribution of one's own attitudes and urges onto another person because of intolerance or painful affect aroused by those attitudes and urges. A person blames another for his own mistakes is using the projection mechanism. Thoughts most commonly projected onto another are the ones that would cause guilt, such as aggressive and sexual fantasies or thoughts. For example, someone who is frustrated by his superiors may go home and kick the dog or beat up a family member. Or a surgeon whose patient does not respond well may tend to blame the theatre head nurse who was present at the time of operation. The projection defense mechanism is one of the most damaging as it may result in extreme feelings of paranoia and anxiety. Repression. Repression is unconscious blocking of unacceptable thoughts or unpleasant and conflict-producing emotions. It keeps information out of conscious awareness. However, these memories don't just disappear, they continue to influence our behavior. With repression, our mind makes the decision to bury the memory in our subconscious, thereby preventing painful, disturbing, or dangerous thoughts from entering awareness. For example, a person who has repressed memories of abuse suffered as a child or other traumatic experiences that occurred early on in development may later have difficulty forming relationships. Repression is another well-known defense mechanism. Suppression. Sometimes we do this consciously by forcing the unwanted information out of our awareness or an intentional pushing away from awareness of certain unwanted or unpleasant ideas, memories, or feelings, which is known as suppression. In most cases, however, this removal of anxiety-provoking memories from our awareness is believed to occur unconsciously. For example, a student consciously decides not to think about her weekend so that she can study effectively for her upcoming exams. Rationalization. Rationalization occurs when an individual tries to justify his failures and socially unacceptable behavior by giving socially approved reasons. That is, when a person finds a situation difficult to accept, he will make up a logical reason why it has happened. In most cases, this won't actually help you to justify your behavior. Instead, the opposite effect will occur. Those around you will view you as childish or egoistical if you are unable to own your mistakes. For example, a student might blame a poor exam score on the instructor rather than his or her lack of preparation. Rationalization not only prevents anxiety, it may also protect self-esteem and self-concept. Intellectualization, focusing of attention on technical or logical aspects of a threatening situation. Rather than deal with the painful associated emotions, a person might employ intellectualization to distance themselves from the impulse, event, or behavior. Intellectualization allows us to avoid thinking about the stressful emotional aspect of the situation and focus only on the intellectual component. For example, a person who has just been diagnosed with a terminal illness might focus on learning everything about the disease or focuses on the details of all possible medical procedures in order to avoid distress and remain distant from the reality of the situation. Compensation, attempting to overcome feelings of inferiority or make up for a deficiency. For example, becoming a high school basketball coach rather than a professional athlete. Sublimation, sublimation is a defense mechanism that allows us to act out unacceptable impulses or behaviors into personally satisfying and socially valuable behavioral pattern. Sublimation occurs when you transform your conflicted emotions, unmet desires, or unacceptable impulses into productive outlets. For example, a person experiencing extreme anger might take up kickboxing as a means of venting frustration, or a hostile young man who enjoys fighting becomes a football player. Sport is another example of putting our emotions into something constructive. Sublimation is a sign of maturity that allows people to function normally in socially acceptable ways. Sublimation is similar to displacement but takes place when we manage to displace our unacceptable emotions into behaviors which are constructive and socially acceptable rather than destructive activities. Reaction formation. Reaction formation is a defense mechanism in which an individual tries to hide his true feelings by behaving in the exact opposite manner. Reaction formation is the converting of unwanted or dangerous thoughts, feelings, or impulses into their opposites. That is, unacceptable real feelings are repressed and acceptable opposite feelings are expressed. For example, treating someone you strongly dislike in an excessively friendly manner in order to hide your true feelings, or a young man with homosexual feelings which he finds to be threatening or socially unacceptable engages in excessive heterosexual activities. Displacement. Displacement involves taking out our frustrations, feelings, and impulses on people or objects that are less threatening. People often use displacement when they cannot express their feelings in a safe manner to the person they are directed at. Displaced aggression is a common example of this defense mechanism. Instead of expressing our anger in ways that could lead to negative consequences, we express it towards a person or object that poses no threat. For example, a person who is angry with his boss but cannot express his anger for fear of losing the job may fight with his wife and children on return from the office. The man is redirecting his anger from his boss to his wife or children. Naturally, this is a pretty ineffective defense mechanism because while the anger finds a route for expression, its misapplication to other harmless people or objects will cause additional problems for most people. Conversion, a mental mechanism in which an emotional conflict is expressed as a physical symptom for which there is no organic basis. For example, a student very anxious about his exams may develop a headache. Acting out. In this, an individual copes with stress by engaging in actions or performing extreme behavior in order to express thoughts or feelings the person feels incapable of otherwise expressing. When a person acts out, it can act as a pressure release and often helps the individual feel calmer and peaceful once again. Instead of expressing in words, a person may act out when he is angry. For example, a child's temper tantrum is a form of acting out when he or she doesn't get what he wants from his or her parent. A person throwing book when he is angry. Undoing. Undoing is an attempt to take back an unconscious behavior or thought that is unacceptable or hurtful. For instance, after realizing you just insulted or hurt someone, you might spend the next hour praising them in order to. The initial crucial step in changing your defense mechanisms is accepting that you are using them. Once you realize how you are coping with stress or negativity, you can more easily change your thoughts. Everyone deals with different types of defense mechanisms, but when you depend too much on these defense mechanisms, it's time to analyze your behavior and change your ways. Thank you.